All right, wonderful. Again, thank you all so much for joining us this afternoon. We are excited to have you with us today and hear from some different folks across the state to learn more about a variety of health science fields, and hopefully that maybe answer some questions you might have about animal sciences also. We do have a health science heavy panel today, and we know that from your registrations, you will have a wonderful variety of careers that you are interested in. Of course, if we had all of those careers on here represented today, we wouldn't get through talking about them all because there are so many great ones. So we are going to focus on a few different careers as we go through. If you all have questions, please send them over in the chat and in the Q&A feature. Those are going to be some good things as we go through today. This program is being recorded, so we'll make sure we get a copy of that recording out to folks as soon as we can. And we have a really good panelist, as I mentioned today, and I am going to get everyone introduced and have some great bios to read. I just wanted to make sure that we were all kind of on the same foot of where we need to be today. So who are we and what are we doing this for? So this is College Foundation of North Carolina, CFNC.org, and my name is Assistant Vice President of College Access and Community Outreach. And I come to you today from Wilmington. So I know you all might be all over the state. So that's exciting to have us all together. But in case you are not familiar with CFNC, okay, we are your free resource, state-sponsored resource nonprofit to help you all plan for education steps past high school. Okay? So we are free, again, provided to you by the legislature. So for all of you North Carolinians, and we have lots of resources on our website to help you with career planning, which is kind of where we are right now, right? It's this career planning area, learning more information. We have lots of great free career assessments on our site that you guys can take, and you can figure out which colleges offer those programs, which is also kind of where we are today with this panel. And you can apply to most of those institutions offer CFNC, send official high school transcripts, look for financial aid information, apply for scholarships, and so on. So lots of wonderful resources for you there. We officially kicked off Countdown to College, our 18th year of doing this on Monday. And Countdown to College is a CFNC initiative where we are happy to provide lots of great resources to help students with the three main areas of applying to college, which includes residency, financial aid, and admissions applications and all that admissions information. Those of you who are on that are seniors, and some of you are, a lot of you are actually, this is a great month where you will likely find various programming happening in your school to help you with all these great areas. And if you're not a senior, don't worry, we do this every year. And the third week of October is College Application Week, okay? And College Application Week is a week where a lot of our institutions in North Carolina waive their application fees. Okay. There's usually programming in your school with volunteers to help you go through the admissions process and answer all those great questions that you might have about those applications. Okay, so lots of great things. So hopefully folks can hear me. I'm almost done with my talking part. Thank goodness, because I don't know if I've got some sound issues here. But so just great things. So if you haven't checked it out yet, cfnc.org/C2C is where you will find all of those wonderful resources and list of colleges waiving fees. So I am going to pause for just a minute, and I'm actually sharing for a moment because this has happened before. My words here are not showing up evenly on the page. I'll try and fix that and come back in just a minute. So in the meantime, what I will do is I want to introduce you to our wonderful panelists. Okay, so first we have Dr. Adrienne Marino from Wingate University. So she's a clinical faculty member with Wingate University School of Pharmacy. And Dr. Marino teaches in the pharmacy program, and she also has a family medicine practice site where she, precepts students while also helping patients. So she gets to do all that, and she really enjoys watching students and patients grow and thrive. So we're so excited to have her here today. And we also have a little bit of information on Wingate as a whole. So I think that's a really good thing. It's near Charlotte, in case you are not from that area. Beautiful campus, and the town is called Wingate, short drive from Charlotte, so very close to Charlotte, like I said. Students have lots of cultural, professional, and recreational opportunities, lots of, diverse student body, about 3,500 undergraduate and graduate students. So not a huge campus. That allows for personalized attention and a strong sense of community. So that can help you get to know all the other students and faculty and staff members. And Wingate University is renowned for its comprehensive health science program. So that includes pharmacy, physician assistant, nursing, physical therapy, occupational therapy, social work, and public health. So I think that from your registrations, there's a little bit of all of that you guys are interested in hearing about. Dr. Marino is here today to specifically kind of get some information on pharmacy side of things. So Wingate University is dedicated to health sciences, and it's exemplified through its cutting edge facilities, experienced faculty, strong partnerships with healthcare institutions in the region. So we have some links and resources that you can reach out to, which I will put in the chat in just a couple of minutes. But I'm going to come through and introduce some of us next. We have Caitlin H. Rice, and she is an associate professor in the Department of Health Sciences and Information at East Carolina University. And that is in Greenville, 2 region. Still having some sorry, guys. I promise I'm going to read some bios and then kick it over to our panelists and hopefully their sound is okay. But Mrs. Rouse is in the College of Allied Health Sciences, and she's the faculty advisor for the Student Health Informatics and Information. So she has her undergraduate degree in health management and master's in health informatics and information management, all from ECU. So this is a really good piece of health sciences that is a little different with health information management. And she serves in various committees. So she's helping out with the different departments at the university and also in the Department of Health Services. So she is an excellent resource for all of these things and is the communications chair for the North Carolina Health Information Management Association and secretary of the East Region of that same organization. So prior to this, she had health information management experience as a coding and claims analyst at a large clinic practice. And she's really interested in health industry education, clinical documentation, improvement, data analytics, electronic exchange of health information, privacy and security, and healthcare reimbursement systems. So lots of really wonderful bits of information here for everyone. So hopefully you guys are hearing me okay. I have another bio that I want to read, and then I'm going to let our folks from Cape Fear Community College introduce themselves. The third one I'm going to read is Kayla Flynn, who is a clinical assistant professor also at ECU, East Carolina University, with the College of Allied Health Sciences. So Ms. Flynn received her Bachelor's of Science in Health Services Management from ECU 3 years ago in 2020. And she started her healthcare career at UNC Health Nash as the education technical assistant and moved into the organizational learning specialist position during her time there. So really interesting background there. During her time at Nash, she started teaching instructor at Martin Community College in their medical office administration program, which is online. So if any of you are thinking about taking some of these courses online, Ms. Flynn might be able to answer some questions about that as well at work. So she started education specifically in healthcare administration. So she held the Master of Healthcare Administration, which is an MHA program at UNCW. So after that, she went back to that same department that made her into the healthcare professional that she is today. So all really great information and super excited to have this variety here for you today. And lastly on our panel, we have 2 folks from Cape Fear Community College, which is located in Wilmington. We have Haley Crouch and Trinity Shelton, And I'm going to mute myself here and just let them tell you about what they do, and then we'll dig into some questions here.
Hi everyone, my name is Trinity Shelton, and this is my colleague Haley Crouch. We work with students that are interested in our selective admissions health science programs. We are representing Cape Fear Community College today, and we have about 15, selective health science programs. Our role is to really help students understand what are the different options that we have in terms of healthcare careers, which one is going to be a best fit for them, what do they need to do in order to pursue this program, get accepted into the program. We do a little bit of career exploration with students. And we really, enjoy helping students figure out kind of, how they're going to plan their future. We partner with a lot of other colleges in North Carolina with some bridge programs with some of our health science programs. But we're just excited to be here today and answer some of the questions that you guys have for us.
Awesome. Thank you so much. Really appreciate that. And again, students, as you have, well, and anyone who's on today, as you have questions and comments and thoughts, feel free to send them over in the chat, or you can use the Q&A. But as I kind of work through the PowerPoint and try to get the visuals to pop up here a little better so you can read the words, I'm going to kind of allow the rest of our panelists to just answer the first question that we have, which I'll just offer kind of verbally. And so we're just looking for you to tell us a little something else about yourself or your college or career that you are representing today. So we will start with Dr. Marina from Wingate, if that's okay.
Awesome. So glad to be here. Thanks for having me. So April kind of mentioned during my bio, I teach in the School of Pharmacy. I'm actually a Wingate. I graduated from Wingate Pharmacy School and also did residency here. So loved it so much that I stayed. So I get to teach in the School of Pharmacy and then also precept students out on their clinical rotations at similar to what you would think of as like a doctor's office. So there I treat patients for things like diabetes, high blood pressure, cholesterol. In this situation, the physicians do most of the diagnosing, and then my team does the majority of the treatment. So it's a unique practice site for pharmacists. Other things just more specific to Wingate, we do have 2 campuses for our pharmacy program. So we're here in Wingate right outside of Charlotte, and then also more towards the mountains in Hendersonville. And we take pharmacy students as well as PA students on both of those campuses, and I represent the pharmacy department. There are lots of different avenues to get to pharmacy. I think it's always unique and notable that to get into the doctoral program for pharmacy, to earn a doctorate in pharmacy, you don't necessarily have to have a bachelor's degree. That's definitely one route to get there. You can complete your prerequisites and come straight to pharmacy school. So for some students who are doing early college experience, dual enrollment, getting those credits in high school, some students come to us in as early as 1 year of undergrad studies. Some do it in 2, some do it in 3, some complete a degree and then come to us. So I think that's something unique to pharmacy that I wanted to highlight today. And one other thing I'll just highlight that as I talk to students, something that I guess is most surprising to students and to the community at large. A lot of times when we think about pharmacists, we think about, our CVS pharmacist, our Rite Aid pharmacist, and those are the pharmacists that most folks interact with most commonly. But there are certainly pharmacists within the hospital dispensing medications. There are pharmacists on the floors helping to make clinical decisions. There are pharmacists in research, in doctors' offices. There are over 100 different career paths for pharmacists. So something to just consider. And April can share a link, or I can put a link in the chat if you just want to look at some different career paths for pharmacists. So certainly open to answering any questions that you guys have today. And I'm looking forward to chatting with you guys.
Awesome. Thank you so much, Dr. Marino. And so we're going to move over to Mrs. Rouse now, to Caitlin Rouse with ECU. And if you could just, any other words to introduce yourself or the program, your school, and the career you're representing today, or careers, because we have multiple folks doing multiple careers today.
All right, thank you. So I am Caitlin Rouse, and I am at ECU. I am representing the Health Services and Information Management Department in the College of Allied Health Sciences. but I know that some of you are probably interested in PA, PT, OT. And so that we have in our college, the College of Allied Health Sciences, we have nutrition sciences, occupational therapy, physical therapy, physician assistant studies, addictions and rehab studies. We also have clinical laboratory sciences. And so we are a diverse college. The two programs that I am representing is Health Services Management and Health Information Management, which are typically for people who do not want any hands-on patient care, but still want to work in healthcare. And so we are behind the scenes. We make sure that the facilities are running as they should, making sure that the providers are getting paid, that the patient data is kept safe and secure, and different things like that. So one thing, if you are interested in PA or OT, PT, we do have a lot of students who complete their undergraduate degrees in either health services or health information management, because it does allow them to complete the prerequisites to go into those programs. So if you have any questions or anything, please ask. And I will also put the link to our college so that you can explore the different departments and the different programs on the web.
Awesome. Thank you so much. And we'll move over to Kayla Flynn, also with ECU. Same question, if there's anything else beyond the bio that you wanted to mention and talk about your program or programs, ECU, and then we can keep putting links and stuff in the chat. Thank you.
So I work with Professor Rouse, or Caitlin Rouse. I'm in the Department of Health Services and Information Management as well. I'm at ECU in the College of Allied Health Sciences. Like you said in my bio, I graduated from this program and now I'm back working with one of my professors. Professor Rouse was my professor when I was in college, and now she is my colleague. I wanted to be a PA straight out of high school. And then when I got into college and I realized what that entailed, I realized that I did not want to be in direct patient care. When people are sick around me, I run away from the germs. So that's why I knew that direct patient care was not for me. So this degree path was really good for me because it's behind the scenes, and you don't have to be around, you can be around sick people, but you don't have to necessarily touch them. That was my thing. And then blood too. I'm not a big blood person. So if you're like me, this might be a good way for you to do school. And if you have any questions for me, I'm happy to answer them. Thank you for having me.
Awesome. Thank you so much. Trinity and Haley over at Cape Fear, is there anything else that you guys wanted to mention about your program before we move on to some other questions?
Yeah, I can just touch on maybe some of the specific programs that we offer. We have several different nursing programs, both practical nursing and the associate degree option. We also offer both medical and cardiovascular sonography, some dental hygiene, some dental assisting, medical assisting, occupational therapy assistant. And those are all, direct patient care programs, but we also offer like a human services technology with a mental health focus. We have a health and fitness, exercise science program. So we offer, quite a variety of different health science programs. But Haley and I, are, like I said, again, we're just excited to answer any of those questions you might have about those specific programs.
Thank you so much. And I tried to move some stuff around here so maybe we can all see the questions a little better, but if not, we know. So, okay, let's come over to Dr. Marino, and we're with Wingate. And the question is, so we're thinking of your own career. So as a lot of our folks and a lot of us in the real world is we're doing multiple things. So it's not like we're necessarily going into an office every day and doing the same thing on repeat. So for Dr. Marino, for example, you've got you're teaching, you've got pharmacy. So think about those things. What might a day in the life of someone teaching and or doing practicing pharmacy, or I have a friend who's pharmacist with a traumatic brain injury. division of an institution. So really cool stuff. So what might something look like for you? A day in the life or a week in the life?
So I'll give the example of what a clinic day looks like for me. So for instance, if it's a day where I'm in clinic, I would get to clinic early in the morning. I would get my students situated. We would start to review our patients for the day. And so we like to see about one patient an hour. So it gives us plenty of time because most of you, I'm sure when you go to the doctor's office, you don't get nearly enough time to see your provider, and your providers agree that they don't get quite enough time. And so you think about a patient who may go to their doctor and they may have heart failure, COPD, diabetes, and they have like 15 minutes to chat with their provider. So their provider can refer them to our pharmacy team for a specific need such as diabetes, and we can spend 1 hour with them chatting through what does it mean to have diabetes? What do the medicines look like? How would you monitor for your blood sugar? How do you use the devices? What side effects might you consider? What are lifestyle habits? How might you need to change your diet? How might you need to change your exercise regimen? And so we talk about all those things, lots of patient education. We can make some medication adjustments. So increase, decrease, start or stop medications. Work with the physicians to make sure the prescriptions are sent over, that the patient has access to the medications. And that's what basically a patient visit looks like. And then of course we document those encounters and then on to the next patient. So that's kind of what clinic looks like. Sometimes physicians will walk over and ask medical questions like, hey, I want to start this patient on this. Do these medicines interact? Or I want to start my patient on, this medicine. It says it's not covered on their insurance or it's very expensive. So we can offer resources to help reduce the cost of the medication or suggest an alternative perhaps. So that's really, we also work with medical residents at my practice site. So that's always fun for students to get some of that layered learning with medical residents and pharmacy students alike. So that's kind of what clinic looks like. And then when I head over to school, I teach, right now I'm in what's called Skills Lab. So I think that's a kind of fun course because while the pharmacy students are in courses where they're learning about therapeutics. So let's say that they're in cardiology and they're learning about how the heart works and all the conditions of the heart, then they get to hang out with me in Skills Lab and learn about like for instance devices that are used for that condition, or to go through patient cases related to that and more of the practice side of things to prepare them for those clinical rotations. So we just finished a module on diabetes. So they were learning about diabetes in the classroom, and then they got to come to Skills Lab with me and walk through like how to use an insulin pen or how to use a blood sugar monitor. So that's kind of what I'm doing in class right now. So that could be a day, basically clinic in the morning and then class in the afternoon.
That sounds really good. That sounds so. As students, as you're listening to all of these things, some of you know exactly kind of the career and what the day-to-day would be like, but otherwise, I mean, it sounds like every day might be a little different, wearing different hats and saying different things and helping different folks. And I know some folks are drawn to that and some folks aren't. So that's a good thing to think about as we go through this as well. So we're going to come over to ECU and start with Caitlin Rouse and ask the same question. So thinking about the career that you're representing, so maybe yours or, folks within your department, students in your class, what is something that once they get into the field, what might a day or a week in the life look like?
Okay, so going down the health services or the health information management path, every day is going to be different. One day is not going to be the same as another because typically we like to say we put out the fires at a facility because we are making sure that, the facility can operate, that the providers are getting paid, that insurance is going through for the patients so that the claims will be paid for the patients. We may take care of employee issues, so human resources. Also making sure that we are operating according to the state and federal laws, rules, and regulations that come down from the government, as well as having to report to local authorities or at the state level, the local level, or even the federal level. And so a lot of it is in the background. You are not necessarily doing hands-on patient care, but you may have to take care of a patient issue. If there is an issue with a patient and maybe a bill that they received, or if there's an issue between a patient and a provider. So depending on what area you go into in health information management or health services management will depend on how your day looks. But if you are, say, like a practice administrator, every day is not going to be the same, because you could be implementing maybe a new electronic health record system 1 month or over a 6-month period. And then the next day you might be dealing with some employee issues. And so there is a variety of avenues that are pathways that you can take in either program. For example, if you did medical coding, you would code, and you are a medical coder, you would code all day long. And so you would be reading the health record to make sure that, you know, what are the diagnoses, what services did this patient have, so that we could send it to the insurance company and get reimbursement for the services that were provided to the patient. So for a medical coder, every day would look typically the same, but that's just one pathway that could be taken with either of the degrees that we are representing.
Thank you so much. I love all the variety that we have here. So Kayla Flynn, also with ECU, same question. So what might a day in the life of somebody in the career, what might that look like?
I ditto to everything that Professor Rouse just said. For me, for the side of academia, it may look like me preparing classes, so my face-to-face lectures, my online lectures, meeting with students for office hours, and then we have tons of meetings, so departmental meetings and committee meetings. And then like Caitlin said, it's a ton of variety. I mean, it could, you know, like she said, it could be you're implementing an EHR one day, and then the next day you have a pandemic, which is, you know, what the last 3 years has been. So the variety is definitely there in our field.
Thank you so much. And let's come over to Cape Fear Community College. So we have Haley and Trinity, and I know you guys are with the health science office. So I know we have some folks on that are also interested in veterinary medicine, vet tech program, which I know Cape Fear has. So I'm wondering, one side of that question might be some of the students you're working with and what might a day in the life look like, but then also what does a vet tech program look like? What kind of program is that?
So our vet tech program is very hands-on. It's actually on our North Campus. It's a huge program, has a lot of options for them. So they basically will be going in and they do things like dental work, x-rays on animals, and they use those with the local shelter, mostly cats and dogs, of course. So that program is very hands-on. They even go to a cow pasture a few miles out of town and have a whole lecture on, you know, larger farm animals as well. That is one of our pretty popular programs. That one takes 24 students each year. So that is one of our, you know, of course, more popular programs. Students like that one. But day in the life in our center, we take appointments and walk-ins all day long. So students that have questions with being admitted into our programs, they'll come by and ask questions on that. So all of our selective health science programs have minimum requirements that students need to meet before they're even eligible to apply to the program itself. So we mostly work with students that have questions about meeting those requirements, so they can prepare their application and make it competitive. Because again, since they are competitive, they are ranked and then either accepted, taken as an alternate, or denied. So we help help, you know, plan their future career paths with them and sit down with them and talk all of that out.
Thank you. And I'm going to ask a follow-up question if it's okay. I know that just for a moment, back to the animal sciences or the vet tech program, you said 24 students are admitted each year. Is that
Yes.
right?
Yes.
And from what I understand, it can be the same with like, CNA, RN type of programs. Is there's a lot of students interested in a program that can only accept so many, right?
Yes.
So from your end with Cape Fear here, what would be, so if I'm a student and I'm thinking that's what I want to do, that's why I only have 24, what happens if I'm not one of those 24 that year?
So we do a lot of parallel planning as well. So if a student does not get into the program, they are also welcome to reapply as many times as they'd like to. But we do a lot of parallel planning. So again, we'll sit down with them and kind of hash out their other interests and kind of maybe work with them to figure out what's another path that they can take.
I think another really cool thing is we're just one community college in the state of North Carolina, and there are so many that are going to be, local to some of the students we have here today. And so a lot of community colleges will offer a nursing program or will offer, maybe a dental assisting program. And so, like, we're happy to be here and represent Cape Fear, but if you're interested in these programs, do a little bit of looking at other community colleges in your area. And, we always love when students want to come to Cape Fear, but sometimes, the program is maybe just really competitive. And so we encourage students to look and see if other schools are offering the career that they're interested in. Shadowing is also a really great way to really narrow down, is this the career field for me? I thought that I really love animals, but then when I'm working in the, that med tech program, I see that I have to, maybe draw blood or I have to give vaccines, and I don't like to see animals get hurt. So there's a lot that goes into, really narrowing down and making sure that, what you're pursuing is for you. But that's pretty much just, a day in our center.
That's perfect. Thank you so much. And I don't know why it keeps coming up all wonky like this, guys. Well, I guess it's just having a mind of its own, right? So let's come back over. And we are going to come back over to Dr. Marino with Wingate, and then we'll come back over to ECU. So any tips thinking about, it doesn't have to be 5,000, a tip or two that you would like to say if I could get some students, and keep in mind too that there are some classrooms on here today as well. So we have maybe one login and there's a whole classroom, different grade levels, but we definitely are heavy on juniors and seniors. What might you offer as a tip to students that are interested in your career field?
I think definitely considering shadowing has come up on the call. I definitely recommend shadowing if you can get paid work experience for high school students who think they may want to do pharmacy. If you have an interest in retail pharmacy like a CVS, Walgreens, or a local independent, potentially a paid job there, potentially shadowing or talking to someone who currently does that. And then I would just start investigating colleges that have your major, reaching out, asking questions, going to visit, things of that nature.
Perfect, thank you. So we're going to move over to ECU and we'll ask Caitlin Rouse, same question. Any tips?
I would definitely say volunteering in healthcare organizations, as well as if you are able to get some type of part-time work, maybe you're escorting the patients to their rooms, or if you can do some checking in patients, checking out patients, answering the phone, filing papers, definitely take advantage of those opportunities, no matter what type of healthcare career you're thinking about going in, because it does look good on your resume to go ahead and start building up your network. Also, just make sure that when you start doing your prerequisites to be admitted into these programs, make sure you do really well in your prerequisites, and just stay on top of your studies. Don't get behind.
That's so good. And I'm taking a few notes over here because I think after we do these tips, it'll be good to just, I'm just going to reemphasize a couple of things that you guys are saying as we go through. So same question over for Kayla Flynn, also from ECU. So any tips for us?
Yes. So I was in your shoes not too long ago. It's been a while now that I think about it, but take the college classes that you can now in high school. And when you get to that point in high school, I know a lot of schools in my area, which is Pitt County, you have to wait till you're not a senior, a junior. I didn't start taking college classes until I was a junior. I graduated from Martin County schools. But just having those free credits going into college made me almost look like a sophomore. So I actually graduated in 3 years instead of 4 from ECU because I came in with like 17 credits. So those are free college classes that you can take, now, help your mom and dad out with the cost because they're not cheap, and do those now. And so you'll have those knocked out, and especially prereqs. I mean, I'm trying to think of what I took in high school, like medical terminology, the first English, the first math, um, like sociology, psychology, like knock out those prereqs and general education classes now while you can before you get to the nitty gritty of what you want to do when you get into your programs.
Awesome. Thank you so much. So we're coming over to Haley and Trinity with Cape Fear. So same question. Any tips for students today that are thinking about animal or health sciences?
Yeah, just to echo what everybody else said, I really think that shadowing or getting some kind of like volunteer experience is going to help you figure out, just confirming that this is really what you want to do. I would also say, taking advantage of whether your school offers like a dual enrollment or a CCP program so you can take those college classes, get some credits beforehand. With selective programs, sometimes a student can get in depending on what college credits they already have. So it could mean getting into a program faster. But another thing is just patience, I would say, is key. Patience and persistence, especially for some of our really competitive programs. Sometimes students do have to apply more than once, and that can be possibly frustrating. But once you get into one of these programs, it is a full-time commitment. You want to be on top of your studies. You want to be financially stable. You want to have a good support system. So we always encourage students, if it takes a little bit longer maybe than you're hoping for, or if reapplying a following year feels like the end of the world, you can use that time to really solidify that this is the career you want to, be working and trying to gain some experience, saving up money, planning for the future, because that's also a really big part of, students being able to be successful, I think, as they're pursuing their career choice.
Perfect. Thank you so much. So I was just going to take a minute and recap a couple of these awesome tips that you guys are giving. So one, I think everybody mentioned shadowing. So if you have questions about shadowing and volunteer opportunities, make sure that you're talking to your high school counselor, your college advisor at your high school, because they are going to be aware likely of some of those opportunities. Okay. That's really the best way for you to see what it's like to be in some of those roles and figure out and solidify, yes, this is for me, or, oh, I don't think I have the right thing in mind. No, this is not for me. And maybe it's not even that. Maybe it's, in those opportunities you are learning about other things within health sciences that you're like, well, this one isn't what I thought it was, but this thing over here is super cool. And that seems more aligned with me. So we've got those prereqs. We've got folks talking about taking those prereqs, paying attention to your grades in those, especially. So if you are, let's say you're on here today and you're thinking you want to go into medicine, maybe you want to go to medical school. We had a lot of folks interested in different types of medicine. We had some folks interested in surgery. We had folks interested in pediatrics. It was a variety. And if you're having those prereqs, or if you're taking, biology in high school and you're making a D, that's something to kind of pay attention to. So you're going to be taking, a lot of classes related to biology, right, and human anatomy and the body and all that, and how things work. And so those grades with some of those courses, those really matter. And keeping in mind how you can take some of those courses to have it be free through dual enrollment, through career and college promise, through different things. And again, that's going to bring you back over to your school counselor and or your college advisor, or maybe even your CTE, CDC person in your high school. Right? So some good follow-up opportunities there as you're thinking through some of these great tips. Okay. So we're going to move on to another question here. We're going to come back over to Dr. Marino again with Wingate. Are there any courses that students might want, which this gets back to what we were just talking about, those prereqs, but are there any courses specifically they want to think about taking in high school? What should they excel at? Is there anything that matters more than anything else?
Yeah, and I think we've alluded to this, so I'll be quick, but I think your science courses like biology, obviously, chemistry, you think about the body that we're putting the medication into, so you need to know the biology and then the chemistry of the medication. So biology and chemistry are going to be super important along with math. So definitely you want to try to excel at those courses, and give it your all. And then I would just echo the dual enrollment. Why would you not take classes you can get, high school and college credit for at the same time and come out a lot more prepared. And I think, Kayla mentioned saving money through dual enrollment and taking those college classes. I think that's a big thing for our students too, not only the cost savings and the time savings, but also when they get to college, it allows them to focus more on their core classes like their science and the math, because they don't have to take so many classes at one time. So that's another added bonus.
Perfect. Thank you so much. So same question coming over to Caitlin Rouse. So we're at ECU. So we talked a little bit about this. Any classes they might want to consider beyond what Dr. Marino was talking about, or things they need to excel at?
Yes, so I would say for our programs, the business courses, your math courses, technology courses, as well as, of course, the health science courses, particularly medical terminology, anatomy and physiology, because some of those courses in high school, they, even if they don't count for college credits, you're going to have to take some business, statistics, midterm, anatomy and physiology as prerequisites to get in most of the programs that are represented here today.
Wow, that's so good to know. And I'm going to recap some of this also after. So same question for Kayla Flynn, also with ECU courses, excelling. What do you think about this?
So in my county, I don't know if all counties in North Carolina are like this, but we had the Health Sciences Academy. And so we had to take like the Health Sciences 1 and 2 and Health Team Relations, I think, and Biomedical Technology, I think was the other one. So those helped me know that I wanted to do something in the health science field. And then as well as what Dr. Marino and Caitlin said as well, like medical terminology. Fun fact though, there's 2 of those classes. And MedTerms 1 does not transfer to a 4-year university. Only MedTerms 2, but you have to take MedTerms 1 to take MedTerms 2. So that one will transfer, but just make sure that when you are taking your classes that you kind of have an idea of what you do want to do. And so the classes that you are taking will transfer to wherever you do want to go.
That's a really good point. And that is going to be, and it's perfect as we transition over to Kate Fear talking about this and transferring courses and all that. Students that are thinking about that, either courses you're taking in high school or community college, transferring, you've got to make sure that you're self-identifying as a student, that you're interested in transfer, and I know, not necessarily that with this one course, but, make sure that you are, in the right place, right? And talking to the right folks to make sure that folks know what your plans are and the direction you're going to go. So I'll pass it over to Kate Fear. So what do you guys think, Kaylee and Trinity, thinking about the courses they're taking in high school and anything they should be excelling at?
I agree. Some science and chemistry are a big plus. Anatomy and physiology is a big one, like a lot of the others mentioned, because taking that class will help you when you have to take it in college to get a better grade. We use point count sheets for acceptance. It's all based on points. We rank from highest to lowest for acceptance. So maybe taking an anatomy and physiology class in high school to then take the college level will help you excel in that class that's needed to sometimes apply or just get points for our selective health science programs. And then again, being dual enrolled is always a big plus, getting some of those knocked out beforehand. Even a nurse aid class, I know some of our public high schools do offer that. while the students are still in high school. And that again gives you experience figuring out if that really is the career path that you do want to take.
Perfect. Okay, and I'm gonna jump over to the chat. We've got a couple questions, and this would be for anyone who feels like they might be able to answer. So we have a student that's asking if they don't start their dual enrollment until second semester of senior year, do colleges still accept those credits? Let's say, I know Kayla was talking about dual enrollment, and then maybe Trinity, Haley. Any of you want to talk to that, to dual enrollment senior year?
Would you mind reading the question again? We're having
Yes.
trouble with our chat function.
Oh yeah, no, you're fine. Well, and this was a private message over here. So
Oh.
if this person, that's probably why you can't see it. But if someone's is starting dual enrollment second semester of senior year, colleges, are they still accepting those credits? Is anything different since they waited until then for dual enrollment?
Yeah, so when a student is getting ready to take, to my knowledge, like if a student is getting ready to take classes here at Cape Fear, once a student, graduates from high school, we would need that, final transcript, and it would show on the high school transcript what dual enrollment classes a student was enrolled in, and then it should be able to transfer during their senior year. I wouldn't see why that would be a problem. The earlier you can start dual enrollment, I think the better, because it gives you the opportunity to take more classes. But in terms of transferring, I don't think that it should be like a barrier for you in terms of, can I transfer my course if I wait till the last minute? Just, as long as you pass the course with a grade that allows it to be transferred to, to between community colleges, I think then that answers the question.
Okay, and there's one other question in the chat. So I think it's kind of almost two parts. So one is we've got a student who's interested, and their plan was to go to Gaston Community College to do a vet tech program and work, and then switch. I think you're thinking like transfer to NC State. So one part of that question is, is it a good thing, to think about starting at the 2-year level and transferring to 4-year for programs? And Kayla from ECU, said, it's a great option. It's cheaper. You can knock out some basic classes. Other things too you can consider for students is, are you ready to go off to a 4-year school? Are you in your your personality and your maturity and all of that? Are you ready to head straight there? Do you need to stay home a little longer? Do you need to be close to home for whatever reason? A lot of us have 4-year schools very close to us also. So there's, a lot of different reasons. There's that financial one. And then I'm going to kind of pivot back over to Trinity and Haley. Specifically, how does an associate's degree with the vet tech, how is that transferable over to a 4-year institution, i.e. NC State, for veterinary medicine?
Yeah, so I know that our VMT program is currently, either I think in the process of finalizing or has finalized like a bridge with, I believe it's Appalachian State University, so that, students that graduate from our VMT program and want to pursue higher education can do that. And I don't know, of course, specifically for Gaston or other community colleges in the area, but a lot of schools will have partnerships with 4-year colleges that you can, do an associate degree in a health science field, or, just an associate of science or arts or something, and then you can go ahead and transfer and kind of get more education centralized to what you're hoping to pursue. I would say that's very common in the health sciences as well. Like for our associate degree of nursing, if you wanted to pursue a bachelor's or a master's, within the state of North Carolina, those specific program classes would transfer.
Awesome. And this comes back to for the students, making sure that you're self-identifying. So if you're on and you're thinking, well, I was kind of planning on this specific program and getting out and working, and then maybe, for the Gaston Community College example, I think it would be a good idea to maybe reach out to someone in their vet tech program, because you want to ask, what classes transfer where are they at? Are there other students that have done this? I'm sure there are. But don't underestimate, we've done a lot of programming the last month that have been for educators, so for counselors and college advisors and such. And it has been a very popular suggestion and reminder that your community colleges are resources for your community. So even if you're not thinking of attending one, or even if you are, you can reach out and ask questions. So they're a good resource. I know there's more questions in the chat. I'm going to come through and look at those in just a moment. We're going to come over back to Dr. Marino, and we are going to ask, what are the courses like in college that students might take? Any tips there?
So just in case anyone is not interested or not aware, like when we mention the word prerequisites, so those are courses that are necessary before you can get into your major or before entering a certain graduate program. So for us in pharmacy, we have a list of prerequisites. Those may be different for different pharmacy schools. So for us, it's a lot of biology, chemistry, math, some general education courses. So I would just say, make sure that you're talking with your college advisors once you get to college on what classes you should take to keep you on the right track, to make sure that they're necessary for your major or for your program of study. But for pharmacy, again, a lot of chemistry, biology, and math.
Thank you so much. And, with those classes that we were talking about at the high school level, kind of reminded me here, we've got a few different courses that have come up more than once. Obviously, biology, health sciences type of programs, depending on what institution you're at and what major you're going to have. Math came up a lot, which I think is really important, because I think a lot of students might be in a class and think, well, what does this have to do with what I'm going to do? Well, it has a lot to do with it. And if you think about, let's think about that. Let's see, you go to your CVS and you're talking to your pharmacist, and they've really got to figure out, just on a very basic cellular level, right? Like how much medicine do they give you? And they might have to think about your weight and your age and all of that. And there's some math in there. So, right. So just at the very, very basic level here. So math is not to be forgotten. And what's also interesting about some of the careers that ECU is talking about is the business side of things. Right? Healthcare can be a business, right? And there's folks that need to run that business and administer it. And so there's some really interesting opportunities there also. So thank you so much, Dr. Marino. I'm going to come over to Caitlin Rouse, and we have the same question. So what might some courses be like they would take in college as far as your side of things?
Okay, so some of the prerequisites are very similar to the clinical programs for both of our programs: anatomy and physiology, biostatistics, college algebra, medical terminology, introduction to computers, and professional roles in the healthcare environment. So, anatomy and physiology and med term, very similar to the other clinical programs, but then we have more of the business or math classes. But once you are in our program, so we do admit 60 in the health services management program every fall and 15 in the health information management every fall. And so both the way that we admit, when we admit in the fall, the cohorts begin together and most of their classes are the same their junior year. And then they branch out into health services management or health information management starting the summer of before their senior year. So some of the classes that are the same for both programs would be like healthcare payment systems, health data management, quality improvement, applied research methods, let's see, written communication and documentation, leadership, human resources, and law and ethics are the main ones that are the same for both programs. But then when they branch out, they go to, for like health information management would be like privacy and security in health information technology. It would be your health information technology systems. It would be like health data structures, coding and classification systems, where HSM is going to be more economics, marketing, medical practice management. So that's kind of, how it looks like for both programs.
Perfect. Thank you so much. Kayla Flynn, also with ECU, anything you want to add to some of those programs and the classes?
Not really, maybe just the delivery of it. So most of our classes, we offer them online and face to face, with the exception of some classes that are only online. So that kind of gives you an advantage to have good time management and organization, because you might be like, okay, I've got class from 8 o'clock to 11 o'clock, and then I've got these two online classes that I can go home and work on. So I like the flexibility of that from a professor standpoint as well as a student standpoint.
Awesome. Thank you. We're going to have the same question over to Haley and Trinity from Cape Fear Community College. Classes there, what they might be like, and tips for students.
Oh, sorry, I can go. I think just to echo, like, anatomy and physiology for most of our health science programs, but you're also just going to have like general education classes, and English, sometimes a math, social sciences, a humanities or fine arts, sometimes more than one English. So, those are going to be general classes that students can take before they even apply for our programs. Most of these programs, you could also take those classes while you're in the program. But once the student gets accepted, when they're taking their nursing classes, when they're taking their sonography classes, the majority of those are going to be pretty full on. Students will be in class, 4 or 5 times a week. They're going to have sometimes more than one nursing class or more than one sonography class at a time. They're going to be learning those hands-on skills in the classroom, but then they're also going to be participating in lab sessions where they're going to be practicing those skills. They'll have clinical partnerships that will start, either halfway through the first semester or into the second semester, where they'll be, gaining more real world hands-on experience. So we often tell our students that when you get into a health science program, it's kind of like its own full-time job here at Cape Fear. You're spending a lot of time in class, a lot of time practicing your skills. And so, it's a lot of work, but a really good way to prepare yourself is to take some of those general classes before, just so that you can kind of lighten your load if you get into a health science program. And one thing we really want to stress is that it can be different for every community college that, is within North Carolina. Most of them, would have selective programs, but you really want to just make sure that you're looking into what college you want at a community college level, what courses do they offer in their program, so that you can, make sure that the information you're getting is key to the college that you are, that's close to you or that you're interested in, because it is a little bit different for every community college.
Thank you so much. So same question as far as anything you guys can speak to the vet tech program, also Trinity and Haley.
I'm sorry, could you repeat the last? I heard vet tech program.
Oh, no. Just same question. If there was anything you could add about courses they might take or tips regarding the vet tech program.
Yeah, so I know we'll offer zoology. There will be like some parasitology, I believe, is a class that's offered in our VMT program. Again, just really heavy on the sciences. I believe students have to take a chemistry class before they can apply for the program. But like I said, for the VMT program, another cool factor is that that is a 6-semester program. So it is an associate degree, but it's 6 semesters. And the second summer that students get to be a part of that program, they'll get to do like, it's not a study abroad. I'm losing the term, but they'll get to do kind of like an internship within the program. So they will get to get partnered with a zoo or a veterinarian's office or something like that. They can kind of research and figure out where they want to do like their hands-on, like skills-based learning. So that's a really cool component of our program specifically. And that is an entire class that they'll do in a summer semester. I believe that we had a graduate go and do that skills-based learning, like I think at the Toledo Zoo. So students can really, figure out, if they want to do more, caring for animals that are larger or exotic, or maybe they want to do, like Haley was saying, like cats and dogs and more, domestic animals, they can do that too.
They will also assist with spay and neutering of cats and dogs, as well as do x-rays, like dental x-rays, teeth cleaning, things like that.
Awesome. Thank you so much. And there was a solid number of students who had mentioned being interested in zoology, and I apologize, we don't have anyone specific to talk about that today, but it's just interesting hearing, Haley talk about the types of programs and the internships that students have doing VMT programs. It is not always that you're going to end up as a vet tech at a local animal hospital or doctor's office. So it's a variety there. So I'm going to come back over to Dr. Marino, and I know there's 2 more questions I think that haven't been answered in the chat. I'm going to address one of them right now because I think it's a good match here. So we have somebody who wants to become an OT, occupational therapy, similar to physical therapy, but a little different. And this is a good question for students and anyone else who wants to answer this. So ECU, if you guys want to jump in too, but I'll start with Dr. Marino here. Should a student prioritize colleges with a pre-professional program in whatever that might be, especially if that's a program that's going to require them to go on to graduate school? And we'll start with Dr. Marino.
Awesome. So I think there's multiple sides to this question, and I think you have to consider your situation. Obviously, if it's a school close by that you're interested in and you have the resources and the availability to seek out that school and to go to that school, certainly I think being at the school with your health science program is an added bonus for sure. You gain those resources early, access to those faculty members. You can walk into their building, ask questions. You can seek out mentors, students in those programs already. So it certainly pays off to be at a school that has your program of study. But I would say certainly don't think it absolutely has to be that way. If you're going to do a couple of years of community college near home, or you want to go study at a different school and then transfer, like those things are certainly possibilities. So I don't think it's a must, but it certainly does have some added bonuses to be in that environment early.
Good. Thank you. And somehow we got the same question up here twice, all kinds of fun stuff going on. So in with that, and we're going to come around to another question that's in the chat in a minute, but Dr. Marino, while we're right here, we're going to go through this question for folks also. So are there any barriers that you can think about for students that are thinking about your programs, or any ideas for how you can offer a solution? I know an example, we talked about 24, the limited number of students that perhaps are admitted to some of these programs. But so what's a barrier you might be able to think of, a solution there?
The one that comes to mind the quickest is sometimes between high school and coming to college, students have to adapt their study skills, students come and live in a dorm sometimes, and that's a change of a living situation. They're meeting new folks. And so there's a lot of life changes, a lot of academic changes. And so sometimes that transition into college may come with a stub toe or a little hiccup here and there where students don't perform necessarily as well as they would like to in some of their early college courses. And I would just say persistence is key. Don't give up. Some students come into college and one of the early prereqs for pharmacy is chemistry 101. It's a general chemistry, and students, may have to adapt their study skills and may not perform well in that course or on an early exam. And I would just say persist through, be willing to try something different, contact their professor. I think that's one thing that, being in a smaller environment, I think certainly helps. Getting to know your faculty, be willing to, reach out.
Thank you so much. So same question on over to Caitlin Rouse from ECU. Any barriers or solutions and or things you can think of for this?
So I would say for one, I won't say it's really a barrier, but it's something to think about is that for both of our programs, the last semester, you have to complete an internship and you are also still taking classes within the programs. And so oftentimes we do see with some individuals who are already working full time that that can be a barrier, hard to plan. So my main thing with that would be really know your faculty members in the programs that you are in because we are here to support you. And we want to see you succeed. And so don't be afraid to take advantage of office hours. Don't be afraid to see them after class or ask them, can you set up an additional meeting with them? Because again, we are here to support you and we want to see you succeed. And we do see that oftentimes that students are hesitant to come to our office and talk to us when they're having a problem. But that would be one of the things that I would say. And then any type of healthcare profession that you're thinking about, one thing we see is that you need to have a little bit of background starting in the programs with basic Microsoft Excel. And that has been a huge barrier where we see students coming out of high school and doing their general ed that they do not get the basic Excel skills that they absolutely need once they get into our programs. So, you know, maybe start doing some things on the side to learn the basics to Microsoft. There's books out there, there's lots of tutorials online. So I would say that for any type of career path that you're thinking about going into.
Absolutely. That's such a good tip. Oh my goodness. And there's so many free opportunities out there. Is it Google that has like the free courses, I want to say, or like through, I think you can get like certificates through some of these and then you can like put them on your LinkedIn page to take Excel. You can also just go to Khan Academy, go to YouTube, use YouTube or something else here with, learning some stuff because there's lots of great tutorials there also. To be able to do that because you're really going to need to know Excel and understand how to do some basic things in there, pretty much any program you're looking at. So that's a big one. And I know we're going to come over. I'm just going to recap a couple thoughts so far before we forget. So know your faculty members and pay attention to their office hours. So our students all have different personalities, and I definitely kind of was more on the shy side in college and was kind of nervous to go into a faculty member's office and talk about stuff. And I think that it's important for students to remember that there's no need to feel that way. Like they want to help you and answer questions. And if you are struggling in a class, there is a lot to say for a student to come in.
I'm on a Zoom meeting.
And say, I need help, right? Like I am not picking up what you're putting down. It is not coming through. I need some help with this. I need to learn this. Don't give up, which is also what Dr. Marino said. So if you are looking into a major that a lot of those courses are going to be fun for you and you're good at it, just remember that we're not good at everything. Even within your major, there's very likely going to be a course that is a struggle. You could end up on the struggle bus trying to kind of get through the course. That doesn't mean that all the courses will be that way. There's always going to be that one, right? And so don't give up. Remember that it's a course and you can ask for help and use those office hours. Okay, so on over to Kayla Flynn. Anything else you wanted to add to this about any struggles or barriers that you have seen and any tips on a solution for that?
Definitely just basic use of a computer. I feel like that could go for everybody. I've got a younger cousin that switched from one school to another one, and it was like almost like culture shock because her previous school didn't use laptops, and now she's having to use one every day. And and then like Caitlin said, the Excel and Microsoft, like please try to learn that now, like familiarize yourself with it because I was one of the ones that struggled in our program at first because I was like, Excel, what is that? And now I use it every single day. And like LinkedIn, I had to use that in grad school, and there's tons of free certificate programs up there. And I had to do those for school, so I was able to familiarize myself with more like complex things in Excel that I wasn't able to do prior to that. So that's a great resume builder. And it also looks really good. So when you go into college and you already have a LinkedIn, like add those high school jobs that you may have or may get now, versus later, and then you have this whole portfolio of stuff that you've already done.
Thank you so much. Yeah, all of that technical stuff, you guys, it's super, super important. We're going to come over to Haley and Trinity over at Cape Fear Community College, and we're going to just kind of ask this question generally for you guys. Any barriers, solutions for students?
Like Trinity mentioned earlier, our health science programs are like a full-time job. So a lot of our students that are selected and are in the program have to quit their jobs. So it's good to have a good support system, have a supportive family. If you have children, when you do enter the program, have a babysitter and a backup babysitter. Take advantage of applying for our scholarships. We have quite a few scholarships specifically for our nursing students, as well as general scholarship opportunities and general health science scholarships as well. So kind of just making sure that you have a good support system and you're able to support yourself and a family if you have one while you're in the program.
Thank you. That's perfect. So, transportation. So seems obvious, right? But you got to get to your classes. It's not we're not in the K-12 public school system, so there isn't sort of that bus transport if you don't have a vehicle of your own. But you may end up getting familiar with city buses. Some institutions have their own bus systems to help students, in certain areas, or maybe communal parking lots where they'll come and kind of transport students. So paying attention to that. That scholarship piece that you mentioned is also important. Your institution, all of our institutions in North Carolina, we have about 111 in our state, 2-year, 4-year, public, private. They have institutional scholarships, including our community colleges. You need to go on to the institution's websites and find the scholarship information. Oftentimes you will find it in the financial aid section of the website. Sometimes there are some things that are departmental that are in that area, but you can also be asking your admissions resource, your admissions counselor at the institution, to help you find those scholarship resources and make sure you're not missing any deadlines to apply for those. So some are just really general. They might be need-based or merit-based. Others are based on your major, what department you want to go into. I'm going to pause for just a second here. We have a question in the chat that is specific to looking at vet tech schools, but also I think that this question can very much be replicated for other fields. So we have someone who's in an early college program. They're going to graduate with their associate's degree of science, as well as a high school diploma. So, early college students when they're graduating. So this student is specifically asking about anything that might help them stand out to vet tech schools other than that they're graduating with their associates as well. And we also have a question in the chat, if I can come back and find it as I scroll through, that was very similar. And let me scroll. Okay, so I'll come back to that question in a second. So same thing. So we have a student that wants to be a pediatrician, and they're wondering about things that they can do to help them stand out. So as we're thinking about these vet tech schools, pediatrician types of, if we're thinking about that level of stuff, what can we come up with that might help us stand out? So there was another student that was in the chat that was talking about dog sitting. So we're thinking about the vet tech side of stuff or the veterinarian side of stuff. So is there anything along those lines that would help you stand out? And then same question, I guess, on the medical side of stuff. I know we did talk about shadowing and volunteering, but is there anything else that will help them stand out for admissions? So I think that question might be for everybody.
So for our vet tech program, and again, for all of our selective health science programs, we solely use a point count sheet, and it's all based on points. So there isn't necessarily anything specific that you can do to stand out, just because it's all based on points. For our vet tech program, though, it is required that you do have a minimum of 10 hours of observation hours at a veterinarian office. So that again is kind of like shadowing, gives you, more insight into the career, what you'll be doing when you're working as a vet tech in vet tech school. So again, that going back to that point count sheet, there are specific classes in the general education curriculum in each of the specific programs that you can complete to gain extra points on your point count sheet, making it more competitive, as well as a TEAS exam that we have majority of our programs required before you can apply. So studying hard for that test, just kind of to gain the most amount of points, will ultimately be what sets you apart from the others. It's all about the points.
All right, perfect. And that's similar with lots of community colleges in our states, right? With the point system. Okay. So that's pretty similar. Okay, so now we're thinking on the 4-year side of things. Is there anything that folks can think of that might help them stand out if they are looking at a program that perhaps has limited number of students that they are, admitting, just for example? So it might be Kayla or Caitlin or Dr. Marino.
We also use a point system for both of our undergrad programs. And some of the points are for your prerequisites, what you got in those classes, for example. Now, as far as I was talking about the pediatrician and how you would stand out, I would say, I think, but I'm not positive, like for vet school and PA school, I think you have to have so many hours of observation, as they were saying with their vet tech, but I also think you have to have that for if you're going to like veterinarian school or PA school, potentially OT and PT as well, before you could apply.
Do you mind expanding on what is observation, in case students aren't sure?
I cannot speak to that. I just know I think that might be maybe the vet tech representatives can speak to their observation, what that observation means.
Yeah, so for our VMT program, like Haley said, they require 10 hours of observation. And our program director actually has like a list of different opportunities that students can select in the Wilmington area. But what they're looking for, and this is just for, representing Cape Fear's program, is students, coming in and watching a veterinarian at work, maybe, being a part of a procedure in whatever ways that they can, observing to kind of see, what is this profession like, trying to get some hands-on experience. Maybe they'll hold the animal while the veterinarian is performing a procedure, or maybe they will be taking notes for the veterinarian and, just kind of documenting what's happening in the room. But, a lot of our other programs, like Haley was saying, you can get points for observing. So you can get points for observing a dental hygienist. You can get points for, having some patient care experience, having some bedside manner experience for sonography. And there's lots of, we just keep coming back to this point of how shadowing and observation hours, maybe not even like the documentation on a resume, but like you'll have those hands-on skills so that when you get to a skills assessment or when you get to clinical, you feel more confident in what you're doing. I think your, instructors will be able to see that you have that confidence, that you have the ability to communicate with a patient. And the more you practice these things, just the more natural it feels. And again, it just solidifies, when you're doing these things, like this is really the career that I want to be a part of. When you're doing patient care experience or when you're doing observation, there's a lot of things that you don't know until you get to be in that environment. And so those little details can just kind of be confirmed, like, oh, I do really enjoy working with patients, or, oh, maybe I don't. So even if, a program isn't going to award you points or it's not going to look better on your application, it's still just really important to put yourself in that position to just discover what you want to do as a career.
One additional thing I want to mention is that besides just doing the point system at the university level or the 4-year program, and even past the 4-year program, we also do a lot of interviews for the potential candidates to be admitted to the programs. So we do the point system, but in addition to that, there are interviews that take place.
That's
And I
so good.
wanna-
I'm so glad. Oh, go ahead. Nope.
Sorry, I want to piggyback off of what everybody has said so far. We had a graduate, she was in my class of 2020. She went on to do the OT program at ECU and now she's an occupational therapist. I saw that somewhere in the chat. But she dedicated her summers, I don't know how many years, but she went, there's a special needs camp, I think near the mountains. And so she went and specifically did OT observations and got to work with those kids prior to going into her program. So she had all of her shadowing hours knocked out just from her summer spending with them.
That is so awesome. That kind of gets to it kind of, relates back to what Caitlin was talking about with the interviews. So this experience that the student had with having those observation hours, for the OT program, if Caitlin at Rouse, if Mrs. Rouse is doing an interview to learn if you're a student that would be a good fit for the program, the best way that she's going to know that is your resume and or things that you tell her. So you have to remember, if you're going to go in for an interview for one of these programs, it would be a really good idea for you to spend some time thinking through the different things that you have done, because those of us that have done it before, so mine has been interviewing for scholarships, so it's been a little different. But it's always kind of sad to go through an interview and then learn later something super cool that the student did that really would have been something helpful to know about as they're making their decision. So these different things that you're doing, whether it's, going to do, a lot of observation hours, like Kayla's saying, with one specific thing, or if it's just something else, it feels like it's something that should be mentioned. Just make sure that you're spending some time and that you are self-identifying and that you are providing all of this great information to show what an asset you would be to a program. So, and those of you that are students on and are listening, this is a good point for you to put yourself in these folks' shoes, all of our fabulous panelist members. So now put yourself, in Mrs. Rouse's shoes. So you are interviewing and you've got two different students, right? Just to simplify things that it's come down to. And you've got a student that just kind of took a biology course and you just kind of were out there and you just spun a wheel and this is what you want to do, okay? Versus a student who's come in and has really taken time to do whatever they can, right? So not all students can have the time and the transportation. We have students that are working and students that have to come, contribute to their household. But if you've got a student who has taken time out to do some observing in an area that they're interested in and passionate about, and it's really brought them closer to that career, and you've got those two students in front of you that you're making some decisions on, that might help you think about the other side of things and what would be helpful and all of that. So I'm going to think about, there was one more question in the chat and then just see if anyone else has any final questions, and we are almost out of time. So I just want to run through everyone real quick, and we've got a two-parter here. So one is, we had a really specific question in the chat about a specific career and what they should start researching, but I think that's a really good question just to have open as general. So we'll come back to Dr. Marino and think through one, is there anything else that you still want to mention that hasn't been mentioned about this afternoon? And in addition, is there anything that students could go ahead and start doing or researching to learn more about your program?
Yeah, absolutely. So I would say for high school students, just start researching things that are going to solidify your decision in terms of, if you want to be a pharmacist, like the shadowing that we talked about, what colleges you might be interested, going to visit. I think the way to determine if a place is for you or if you're a good fit is to just schedule a visit. I think that's a great way. And then I would just say one thing that we haven't really hit on is just when you get to college, get involved. For like I advise a pre-pharmacy club for undergraduate students where we're having a meeting tonight and we're talking about the pharmacy school application and what that looks like and mock interviews and how to prepare. So get involved, make those relationships, adopt a mentor, maybe a student who's done what you're doing. And potentially, if you feel up for it, try to adopt a leadership position and get further involved. And I think that always looks great and leads to some additional opportunities.
Thank you so much. And I'm actually working on answering a question in the chat right now, thinking about those extracurriculars, and there isn't necessarily the right one to join per se. It's about dedication, length of time that you've showed commitment to it. Have you taken a leadership position? Perfect. You were saying things right as I was typing them. Thank you so much.
Can I piggyback on something you just said? I think showing commitment to one thing is very important, or to a couple of things. Sometimes we see students who there may be a member in 15 organizations, but they're not really an active member. And so no one can really speak to their involvement. I think this is a time to remember that quality over quantity. And so I would much rather see a student who's active in a couple of organizations, takes a leadership role, volunteers with that organization, knows that advisor, is really getting involved over a student who's not active but a member of 15 organizations. So just remember, it's about quality.
Amen. Thank you. Quality, not quantity, right? So perfect. So same question over to Caitlin Rouse. Anything else we might want to mention that didn't get mentioned here? And then also anything you can think of about the students and go ahead and start researching and looking around.
I would definitely echo what she said as far as going to colleges and visiting the colleges. I'm actually going to put in the chat the link to our fall open house, which is in about a week. There's still time to register for it. It's all ECU, not just our college or our department. And so at the open house is a great opportunity for you to talk to faculty members, talk to students in all the different programs that we have at ECU.
Thank you so much. So again, if you're thinking about ECU, you've got information in the chat right now about open house. Whatever institution you're looking at in North Carolina, get on their website. Get on the website, look around, learn about opportunities, deadlines, open houses, who to contact. The admissions office is going to have someone dedicated to your area. They're regional, no matter where you are. Ask questions. All right, so same question over to Caleb Flynn, also with ECU. Anything we've missed or any tips for getting out there, and let's start researching?
The only thing that I have to add is scholarships. It's free money. Apply to every single one that you can. I think Dr. Marino said earlier, most schools have their own scholarship portals. I know ECU does. And another student asked earlier whether to go to a 2-year first or a 4-year. The only reason I came to ECU first was because I had a huge scholarship. And I highly recommend just applying for everything because you don't know if you're going to get it unless you get it. So unless you apply. So apply for every single one that you can. Some of them are a lot of work. You might have to write a paper or something like that, but also you're treating it like a job because it's free money for you to go to school to get a big kid job one day.
Perfect. That is perfect. Thank you so much. Yeah. Website, visit, scholarships, financial aid, ask questions. And then we're going to come back over to Haley and Trinity. Haley Crouch and Trinity Shelton also, both with Cape Fear. Any other recommendations, things that haven't been mentioned for the good of the group, or tips on starting to research?
So for our selective health science programs at Cape Fear, each year we do an information packet. We update it every year. It has all of the tiny details that are needed for each program. That's very helpful. You can find those on the website. The program directors of each of the health science programs here also put on information sessions. Majority of them are virtual. You can find those dates in the link to join on the program's webpage through the Cape Fear website. So that is something that I would recommend if you're interested in a certain program. You can just log on and listen and get more details about the program itself from the program director.
Perfect. Thank you so much. All right. Any of our panelists have anything else you want to add here? I know we are at time. This has been so good. I personally have learned a lot, and I think it's been very informational, not only for the schools that you're at and not only for your specific programs, but so many of you have opened this up to talking about things that are just in your field and general tips. And I know that the students are truly appreciating it. I want to give humongous thank yous to our panelists, to Dr. Adrienne Marino over at Wingate University, and to Caitlin Rice and Kayla Flynn over at ECU, and Trinity Shelton and Haley Community College. Your time today is invaluable. We appreciate it so much. I'm going to stay on the chat and see if there's any other questions. I think that we really have answered them for the most part. But we just really appreciate your time, and this truly was an excellent virtual career fair. We appreciate it. Students that are on will offer another virtual career fair in the spring. Careers TBA. You guys will get a survey this evening or tomorrow, and we appreciate your feedback because we truly do build these off from your feedback and what you're looking for. Yeah, so happy countdown to college for those of you that are seniors, and college application week will be coming up. Another big thank you to Kate Freeland, who's our outreach assistant, who helped very much set this entire program up. I will be again reaching out to you all. Thank you so much for joining again. I'm going to stop the recording. We'll get this recording out to you probably by Monday. Thank you again so much for attending. This has been wonderful. Good luck to everyone.